Good afternoon, everyone. I'm Caitlin Barron of the Luminos Fund. Welcome to Last Mile Teachers, Cost-Effective Solutions to Catch Up. I'm pleased to be here today together with Minister George Werner, former Minister of Education of Liberia, current member of the Executive Committee of the Education Outcomes Fund, and his role perhaps nearest and dearest to my heart, member of the Board of Directors of Luminos. We're joined virtually by two colleagues, Kathleen Oosthuizen, formerly of Last Mile Health, currently embarking just this moment on an exciting new role with the Girl Effect. And we're joined by Manushi Yadav of the Pratham Education Foundation. The four of us have come together today to challenge our conceptions about what it takes to provide quality education in the most vulnerable communities around the world. So, winding back the clock to the beginning of the pandemic, if we can remember that long ago, George and I were chatting on the back end of one of our Luminos board meetings and reflecting on how health crises in the past had driven fundamental rethinks around what it took to deliver health services and how best to deliver health services in vulnerable, hard-to-reach communities. And we sort of wondered aloud to ourselves, like, why hadn't this moment, the COVID moment, the greatest education crisis the world has ever known, why hadn't that prompted us, the global education community, in a more fundamental sense, to really question who's qualified to teach what, and how can we think differently about extending the reach of the education system footprint to reach the most vulnerable. George, as a longtime observer of innovations in the Liberian space, together with, in this conversation, coined this phrase, last mile teachers. You know, Liberia, a country that is now famous for having revivified the community health worker model, now being replicated across Africa. Why couldn't Liberia play a similar role in rethinking what it takes to bring education to the front lines? So that's really our thesis for today, to explore this idea together a little bit. And I'd love to actually ask Kathleen to help sort of ground us in this conversation and get us started. And I want to make sure we have everyone with us virtually. Yes, we do. Fantastic. All right, wonderful. Well, Kathleen, can you sort of help us set the context then? Help us understand, you know, sort of in the last mile experience, as an example, what is a community health worker? What is their profile? What are their responsibilities? Where do they come from? How are they trained? How are they supported?
Absolutely. Thanks, Caitlin. And can you hear me okay?
Yes.
Great. So a community health worker is a respected person in a community chosen by the community itself to help bridge the gap in service delivery to these populations that are generally considered out of reach of the larger health system. They may have little to no formal health education when they start, but with support and training and funding, they can deliver services, make referrals, and instill public health education and knowledge to a community as a trusted, familiar source. They can quickly identify and treat a child for malaria. They can assist with tracking routine immunizations, and they can recognize the danger signs for early intervention, really.
And Kathleen, give us a sense of sort of how this model has evolved over time. I mean, we've seen some form or fashion of community health workers going back decades, going back as early as barefoot doctors in the Chinese context, right? But why has this model taken off so significantly in the last decade, and what has caused this rethink about the potential impact of community health workers?
You know, Last Mile Health was piloting this model in partnership with the Liberian Ministry of Education as far back as 2012 in some of the most remote districts in Liberia. And if you fast forward to now, the Ministry of Health is successfully implementing the National Community Health Assistant Program with coverage in all counties and with over 4,000 community health workers working beyond that 5-kilometer mark from health facilities. They're all following the same curriculum, they have the same supervision structure, they're even using the same forms to collect information and do program management.
So, I mean, it's extraordinary how this model's grown today, but for many years, for the early years, Last Mile Health was, doing extraordinary work in a fairly quiet corner of Liberia, somewhat out of the global spotlight. What triggered the government uptake?
With the Ebola outbreak of 2014, 2015, the Liberian government recognized this threat of Ebola to its citizens. And that really served as a catalyst to launching the National Community Health Program in order to ensure contact tracing, faster access to care, and containment of future outbreaks. They brought in all of the partners who were in this community health space together to form one program banded together under the national government.
So that's fascinating. I mean, I think at this point in time, we think about the relevance of community health workers as sort of a foregone conclusion, but in fact, it was the Ebola pandemic that drove the real pivot in rethinking about their broad-based relevance. So, George, you were on the ground at that point in Liberia in both a health and an education capacity, and I know you've had the chance to spend time looking at Last Mile's model. I know you spent time getting to know Luminos' work with community teachers. I mean, give us a sense, what does it look like on the front lines, and what might the relevance of the community health worker model be for education?
So thank you, Kathleen, and thank you for coming to listen to us wherever you are. So going to see Last Mile Health in practice was enlightening, because I was the equivalent of the minister responsible for government personnel under Ebola. So I was there at the conceptual stages of Last Mile Health. So when I went to education, when the shadow of Ebola was waning, I wanted to go and see what they were doing. So I saw young people, mostly young women, who were passionate, who were committed, and to their communities, they were the only, quote unquote, doctors. That's how they referred to them. They could see. And when I spoke to them, they were mainly high school graduates. And all of them wanted to go on to college, of course. And so I saw this group of young people, and I said to myself, wow, this is something that is going to go places from here. If you can bring young people from the community to serve their own people in a health capacity. So as you mentioned earlier, the meaning for education is particularly important. One, how is it that when we have a pandemic, health is able to pull together very quickly and respond to an emergency? And health actually has an emergency component. There are emergency rooms in hospitals. How is it that education in an emergency is crippled or paralyzed? So that has significant lesson for us, and that is why our conversation came from myself. Yeah.
It's a fascinating juxtaposition, and I know, one of the things we talked about when this conversation first got started is this idea that that one way or the other, the global health community has made its peace with the idea that there are doctors, there are nurses, there are community health workers. One doesn't replace the other, one doesn't threaten the other, but there's no practical way in most of the countries where we operate of reaching the most vulnerable unless you think expansively about different profiles of team and support. And yet, the idea of anyone other than the teacher playing a role in teaching can still feel very threatening in many corners of the education world. And what is the cost of not thinking differently about that? Well, what that means then is that when we think about the mass of out-of-school children, the mass of learning loss across the globe as a whole, unless we're willing to think differently about who can help bridge those learning gaps, all we're really doing is saddling that same already overburdened teacher with an almost insurmountable task. So this is where George and I were, this sense of like, this feels like an idea that we as the education sector should be exploring, and yet we feel a lot of real resistance to that. And I think if there's any education minister in the world who knows the experience of trying to introduce radical new operating models and then coming up against both global and local resistance, it's probably you. And I wonder if you can just share a little bit about, as a former minister, what's the process like trying to do education in a new way? What do you bump up against?
So let me say first, briefly, 4 things that I feel are common, both what you do in Luminos and what Last Mile does. And it's good to pay attention to those because it will lead us to, 1, there are programs that are based in communities. Community wants them. They are from the communities and of the communities and for the communities. 2, they're both driven by evidence, right? They use evidence to drive their surveys and their outcomes. 3, they are engaged first with governments. So there is no, call it asymmetry in the relationship, in a sense. And the other thing to pay attention to is the social trust. The social trust. Now, why is it difficult to engineer innovation in education? I find that everybody has an opinion when it comes to education. Everybody's a minister of education, right? We don't do the same for health. But everybody has an opinion for education. 2, political will. Education is arguably the most difficult thing to reform to the extent that politicians are worried about touching reform in education. Because, mind you, is apart from health, is the public sector with which majority of the people interact. So voters, implications. So political will, everybody has an opinion. And the last thing I would say that is difficult is courage. The courage to do the right thing. There are issues about finances because every innovation must be backed up by finances. Briefly, my own experience, when we thought about doing different things, teachers audit, the public-private partnership, behind all this, we needed to find financing in addition to public support for them. So those things make it difficult to engineer any innovation in the public sector.
Yeah, I think it's a brilliant frontline synopsis, and presumably one of the major reasons why we've seen relatively little experimentation with a sort of community teachers model in most of the African context. What's interesting is that our colleagues in South Asia have actually been advancing this model for some time. And I wonder here if I can bring Manushi into the conversation. For those of us in the room who perhaps are less familiar with the Pratham Balsaki model, can you give us a bit of an orientation on this model, this approach, the profile of Balsakis, the support, the training, and I think most importantly, given Pratham's extraordinary journey over the last 20 years, kind of how the organization's perspective has evolved and changed on the role of community teachers over time. Oh, Manushi, I think we might not be.
Yeah, I was on mute. I always forget that. Can you hear me?
Perfectly. Thank you.
Great, thank you so much. And yeah, I'll give a very brief background of Pratham's history. I think we started actually doing, we started work with urban slum areas, and the idea was to get children to Pratham-run preschool centers. And at that point of time, we realized we needed local volunteers to help us mobilize the community. So at the very outset, I think the problem was of access and awareness. So going via a set of community anchors is something we felt was the right way to go about it. And that's how our interaction with last mile volunteers sort of started. Now, how they became teachers is, another part of Pratham's story, where we realized that there is a huge crisis in terms of learning levels across the country. Our results showed us that there are children who are inside the school system, who are coming to school regularly, but they are not actually reading at their grade level. So what can we do to sort of help them catch up? And that was the idea. We did not want it to be that, they have to come for summer school or they have to stay back after school hours, because they should not be the ones getting punished. So the idea was that during school hours, we will have a group of these children who've been tested on the ASSER tool, who are not at the level at which they're supposed to be, and they will work with a member from the, adolescent girl from the community, a Pratham Didi, a sister, or we call them Balsaki, which is a children's friend. And she will work with these children on very basic reading and arithmetic skills. And there was an external evaluation for it, but more than just the external part, over many years internally, we saw that using these volunteers, we were actually able to create quite a bit of improvement in children's learning levels in a very short span of time. And from a cost perspective, this was extremely cost efficient because these were unpaid volunteers. They did not require a lot of teaching learning. What they needed was support in how to do mobilization, how to engage with children on very basic techniques of engaging them in these, activities and games that we had come up with under the, the TAL program that we have, teaching at the right level. And we saw that there was a churn, right? We saw that every year we had a new set of volunteers, but we realized it doesn't take long to bring them to a level where they can actually lead to a positive impact in learning levels. Now, over the years, what changed for us was us wanting to experiment more with the program, and we realized that when it's done by Pratham instructors, we are able to look at data in a more qualitative way. We are able to control the quality of data much better. So internally, as part of Pratham's own journey, we transitioned out of a volunteer-led model to a Pratham instructor-led model, and this is early 2010 to 13, 14, I would say. And this is around this period, 12 to 15, And this is around the period where we really perfected this model of teaching at the right level, of the material that is required, the measurement that is required. But at the same time, as we were working with governments to take this pedagogy and have it be adopted by the system, we realized that there are two ways to take it forward, given the scale of problem in a country like India and elsewhere as well. One is we can do a system-led partnership where the government adopts this model, we train the teachers. The other is that the community owns the intervention. So we sort of came back to where we had started. We took the longer route, which allowed us to, do a bit polishing of our methodology, of our measurement methods, but we came back to the same setup where we realized that involving local community anchors in taking this work forward will bring in a lot more sustainability to the work. So starting 2018, we launched an initiative under the whole teaching at the right level ambit of work, which is called Hamara Gaon, which is our community or our village in Hindi. And the idea is that we will continue to be in the community for a period of 3 years. Inside the school system, we will work like we do, we will interact with children directly. But outside the school system, we will have a bunch of volunteers in the community who will facilitate groups of children in the evening, use basic Pratham material, but sort of give rise to almost like a social structure, right? The word that he used, social trust, right? For that to build over a period of time, we needed to do a bunch of activities in the communities and organize these people who can take Pratham's work forward. And thankfully we did that because, after March 2020, when lockdowns happened, it was this whole cadre of people who were actually our footmen on the ground, who were actually able to do stuff when we did not have access to these communities during the lockdown period. So, yeah, that's our experience.
And Manushi, India never does anything in a small way. So can you give us a quick sense of what is the scale of some of these programs Pratham has run currently and in the past?
So right now we are working in around 10,000 communities, reaching out to 1 million children. And I have close to 45 to 50,000 volunteers on the ground who are connected to us via smartphone or, via the SMS mechanism that we followed. And they are the ones who are working with our staff on the ground doing this work.
Wow. And you talked about the transition. Obviously, this model began with a focus on volunteers. Now, that's extraordinarily cost effective. It has certain other trade-offs. But then you talked about moving to a phase of fully employed, engaged Pratham teachers. In that model, how does the cost compare with teachers in the mainstream system?
You mean to say Pratham staff versus teachers in the main system? There's a huge difference. I mean, our staff is also not, I would say, qualified teachers, right? They're not professionals. They are young folks from these communities who've had basic graduate level degrees, undergraduate level degrees, and are interested in this work. So they do not have professional teaching degrees, but they do go through a period of training when they join Pratham. There is, of course, the compliance part of trainings, the HRs and such issues, but the teaching learning practice, we have about, 15-day period in the beginning as they're hired. There is practice work that they do, but in terms of cost, there's no comparison. You can have 5 Pratham instructors for the cost of 1 full-time government employed teacher.
Wow. So it's clear that there's the potential for some real cost savings here, but Kathleen, I know you have some nuanced caution to offer when we think about cost savings through community workers in the near term versus the short term. Do you want to weigh in on the sort of last mile perspective on this question of cost effectiveness, cost savings?
Absolutely. Thanks, Caitlin. When you think about success for the community health worker model, we often talk of the 5 S's and how you measure those 5 S's. And it's very similar to education. You have skills proficiency, you need training. You have supervision, you need to have a workforce who's being supervised. You need supplies, the drugs and the commodities that make the program work. You need a salary. These community health workers need to be paid. And you need national secured funding, which can take time to get and invest, but is really needed for the sustainability. And it takes time and investment to get those 5 pieces in place when you're starting out and when you're starting to scale. But what's really great about seeing how Last Mile Health has done this over time with the government is there's been enough time that they now have a cost effectiveness study. And even with the investment in those 5 S's, it is still going to be more cost effective to have a community health worker model than to build the number of facilities that you would need in order to reach your entire population.
That's fascinating. But I think it's a really interesting insight. There may well be cost savings there, but it may not. It may come only on the back end of investment, which is interesting. I want to make sure we get the chance to open up to the room for some questions. So just want to plant the seed with everyone. Do start percolating your questions. I'm going to go to Manushi with one last question from my side, and then I'd love to turn it over to the floor. Manushi, Pratham obviously has been on an extraordinary journey of extending, leveraging the models you've developed in India and reimagining them in the African context. Much of that work has occurred within the mainstream government school system. I wonder, what from your colleagues' perspective, from your perspective, what do you think the sort of opportunities or constraints are in envisioning something along the lines of the Balsaki model in the African context?
Sure. I mean, anything I say here, take it with a pinch of salt because I'm not directly involved with the work.
We won't hold you to it, I promise.
But I know of one very successful initiative, which is done by Young Love in Botswana, which is also similar, which is, I wouldn't say it's exactly this. You don't have, these are not last mile workers. They are leveraging a national network of students who are part of the Social Service Commission. But what they are able to do is tap into a rich vein of volunteers who are available to work with you in a structured manner, either at very low pay or without any pay, in exchange for any kind of recognition, any kind of certification, and participation in this large organized work. In India, we're not able to do something that at a national scale, given, of course, how big the country is, the way the governments manage at different state levels, but we've seen that has been done really well in Africa. I know that we also have been thinking about trying something outside of the school system in one or two of the African nations that we've been working in to see exactly how this would go forward. And hopefully in a year or so, we may have some direct Pratham, of course, after partnering with a local organization, but we may have some examples from the African continent about this last mile, on this last mile effort. But in India, we've seen that tapping into any kind of organized structure like self-help groups, where mothers are very active participants, very empowered, tapping into those groups as a way to organize teaching learning activities inside communities and be a part of that social structure. So layering education on top of existing social structures within the community is something that's a very good option that we've seen in India and partly in Africa as well.
That's a great suggestion. All right, terrific. I want to make sure we bubble up some questions here. And I think that there is a roving mic, but I'm happy to repeat your question as well. If the lady in white wants to get us started.
My name is Werner, CEO of Asante Africa, working in Uganda, Kenya, and Tanzania. And actually, the whole community home group model is what we're seeing has thrived in Uganda during a two-year shutdown.
Right.
School's about to come back. So I'm curious if any of you as panelists have seen or know of approaches how to benefit from the community learning model as you shift back into the sides of the four walls while still using some of the benefits of a community group.
That's a great question for our panelists who are remote. I'm just going to repeat the highlights. Speaking from the Ugandan context specifically, which has faced one of the longest periods of school closure in the world, there have been a lot of innovations around community-based learning in that time. And so our guest here had asked, how will we leverage and utilize those lessons around community-based learning now as schools are reopening? And I want to, we've got a woman right here in the front row in the blue mask. And I'm happy to repeat for you as well, whatever is easiest.
Thank you. Is that working? Okay, it's working. I can't tell. My name's Samantha from Link Education. So we have a kind of community education model in Malawi, reaching marginalized children, funded through FCDO, but it's called a community basic education, complementary basic education program. That sounds better. And we use community teachers as well, and we train them. They're from the community, etc. How is this model different from a speed school or accelerated learning model? Because they sound quite similar, but I wonder if there are differences that I'm not picking up on. And we have lots of issues around child protection safeguarding, so I wonder how you build that into the community support model as well. Thank you.
Okay, so these are great questions here, and I want to make sure the panelists have time to respond. And I think I can take the easy part of Samantha's question. I think there's a lot of shared traits between Link's work and Luminos's work, and this idea of empowering young people from the community to be a part of the instruction journey is very much in the same spirit. But we've got some great questions here on sort of how do we take the best from community-based learning and bring it back into the mainstream system, and then conversely, how do we think through the risks that children face in a community-led model as opposed to a formal instruction model? I'll turn to our remote panelists first, and then George, maybe you can close us out with thoughts. Manushi, Kathleen, either of you want to jump in on those?
Sure, happy to actually. I'll start with the first one actually about, as we reopen, how do we do it? I think, it goes back to what Caitlin said at the beginning. I think making sure that none of these need to replace the other. I think everyone has there's a possibility for everything to complement the other. That's the idea. So as we are thinking of reopening, we've thought about, there are certain things that we want this community social structure to help us do better. First is, as schools reopen, making sure the most marginalized, the most vulnerable sets, especially, for example, adolescent girls who are at risk of getting married and married off and be involved in home labor, they make it back to school. So using the organized community structure to help re-enrollment, reopening. Once that is done, ensuring that the structures, let's say the community structure and the school structure, they're talking to each other to ensure that attendance continues to remain steady, and increasing the bargaining power at the community side to actually demand for better catch-up work for their children as schools reopen is a very crucial part. And then there is the risk of, more variants coming in. I was supposed to be there in Dubai. I'm not there because of the new variant. So we have, a possibility of localized lockdowns, sporadic, rises in cases. We can't be caught up in a situation where we were in March 2020. So there are 4 pillars to children's education as we look at it. There is the home connection, working exclusively, with parents, especially mothers for younger children. There is the immediate neighborhood outside your home where you can rely on community shared and owned smartphone devices for your children as well as the local group. There's the larger community, which includes the government, run preschool centers in the community and such. And then there is the school system. And all 4 of these pillars need to completely be on the same page so that tomorrow school has to shut down, home can take over, or community can't have something, but school can be the center of getting children back to, the formal system of education or even vaccination for that matter. It's all 4 of these need to sort of stay connected. And this kind of takes care of, what the second question was, that we should not be looking at last mile teachers as, operating in isolation, working one-on-one with children and sort of exposing children to potential risks around, safety and safety safeguarding and such. Because they are part of the community, there is an open space within the community where mothers groups are interacting with younger children, adolescent volunteers or youth volunteers are working with older children. It leads to this whole social trust, also a social structure, but also accountability. If it is owned by the community, you have village elders keeping an eye on what's happening here, who's doing what, while it being facilitated by an external organization. So yes, it's a very, very sensitive and a very crucial topic. But if it is, built in a way that it becomes a key part of the community's practice in their local context, you are able to sort of work your way around the challenges that may arise otherwise. So yeah.
Wonderful. And Kathleen, if you'll forgive me, I may have to give the final word to Minister Werner because he's my boss. So, George, do you want to close this out?
I take it that the
I
time
know,
is out.
but you get a special
So,
extension.
okay. Thank you all for coming. In brief, I think the pandemic offers all of us an unprecedented opportunity for a paradigm shift. And the way we look at it is that we need to learn a lot from health in the way we respond when education is in an emergency. If health has a workforce that is able to go the last mile, we need to start thinking about how to create an education workforce that can go the last mile, especially when we have an emergency such as the pandemic. Thank you all for coming.
Thank you very much.